The big question is, what is this lump? And it's huge. I mean, as a family doctor, I see lots of lumps and bumps on my patient's skin. And I've seen some pretty large ones, but this one, I don't think I've seen a lump or bump as large as this one appears to be.
I'm 59 years old. I'm from Bostonburg, North Carolina, and I have a lump on my back. I guess it started at least 10 years ago. I noticed a small lump. Now it's probably big as a cantaloupe. And I'm just thinking, how big will it get? I can tell the extra weight is heavy. Now I'm walking with a limp because of the weight, so I have to watch it so it won't bump it or hit it. And also working be a lot easier on me. It's just time for me to get rid of it.
Not only is this lump large, but it's heavy. And I can't imagine how heavy that is. He literally said that is walking with a limp because of the lump. He probably also has to get larger shirt sizes to accommodate the lump that's on his back. And definitely, did you remember the scene when he was like working on his car? He bent over. You could literally see the lump. So yeah, he's probably bumping into things. He probably has to be very careful to make sure he's not, bumping into walls and stuff, because it's like a whole other thing.
I have seen doctors before. They said it was a lipoma. The last time I asked one doctor, she said it probably had to have surgery. It's got so big, they were afraid it was closer to my spine. But I kept on putting it off, just thinking it doesn't bother me that much.
Let's talk about what a lipoma is, okay? A lipoma is basically a fatty lump, and it's movable, not like this. But when you move a lipoma, it can be on the upper extremities, the arms. I've seen them on the back. I've seen them on different body parts. But they're almost not squishy, but you can kind of push them. They're mobile, okay? It's a fatty lump. And usually these are benign. They're not cancer causing, although in rare instances there can be a cancer potential, but that's very rare. Generally these are benign, which is good, fatty lump. So let's see what Dr. Pimple Popper says.
This is something that I don't take lightly. Hello.
Hey,
Good morning to you. Hi, how are you?
Nice
Dr.
to
Lee.
meet you.
Nice to meet you.
Can I just say that Dr. Pimple Popper, Dr. Lee, is like the sweetest. I don't know her personally, but I got a chance to interview her for some TV segments I was doing for a show. And she was the sweetest. I was actually really nervous when I interviewed her because she's such a rock star.
Back now a little bit, yeah. And then forward again. Yeah, I mean, I would think that this is above
the
everything
muscle.
else going on underneath there. I can't guarantee that we're going to remove this, but I'm gonna see what we can do.
Okay.
I need to work out more.
Lipomas can be easy, lipomas can be hard. Usually they're easy because they have a pseudo encapsulation, which allows them to pop out really easily. Problem is that it's just stuck and tethered down on the bottom, and it's very hard to get to it because it's so big.
One of the things she's talking about is lipomas are like fatty lumps, but it's basically fat cells that are encapsulated in a fibrous capsule, okay? The good thing about lipomas is they can often be sort of removed all in one lump, one piece. They can be sort of popped out. And when I was a medical student and resident, I certainly saw plenty of lipoma removals where the big glob of fat is just sort of removed. Now, it's a surgical procedure, don't get me wrong. And I also have to say, Dr. Pimple Popper, Dr. Lee, is doing this in sort of an outpatient setting. A lump this big easily could be taken to the operating room. I'm not a surgeon, but I mean, you could easily see that a patient would need, in some situations, to be put asleep to have something like this removed. But yeah, I mean, hats off to Dr. Lee here, I tell you.
Wants to be stubborn.
He does. It's probably like you.
I was finally able to remove this big melon-sized lipoma from Tim.
Right. I'm holding it so it doesn't fall. Guess what? It's out of you.
All right.
Do you feel lighter?
Mm-hmm.
Do you have a guess as to how much this weighs?
7 and a half.
If you win the lipoma.
Okay.
Don't move. 12 pounds, 9 ounces. You broke the internet lipoma record.
This was the heaviest mass that I've ever removed on somebody's body.
Oh my gosh. A 12-pound mass on this guy's back? 12 pounds. That's that's bigger than many babies when they're born. Imagine having a little baby strapped to your back. That's how he was telling the truth when he said how heavy this is. That is massive. That is a massive mass. That is unbelievable. By the way, lipomas often run in families. They often tend to occur around 40s to 60-year-olds, so that's sort of a little bit of a demographic. But holy cow, that was massive. All right, let's see how he's doing.
It's been around 2 months since I've seen Dr. Lee, and it's really changed everything for me. I feel lighter, just walk around, move better. Looks great. Just a little scar, that's it. As far as healing, I think it's doing pretty good. And I'd rather have the scar any day over a lipoma like I had. Yeah, this ought to go on pretty good. Yeah, a lot easier.
God bless him. I swear Dr. Lee is like literally, she's an angel. She's a miracle worker. And this gentleman, I'm sure he feels like he has a whole new life. You know, I think this is a really great story because sometimes when we have lumps or bumps or different things, sometimes it can be very scary to attempt or consider getting them removed. But you know what? Talk to your doctor, talk to a dermatologist, talk to a surgeon, see what your options are, because sometimes, even though he went through a lot to get this removed, literally it's changing his life. So, wow. Let me know in the comments. Do you have lipomas? Have you ever had a lipoma? Have you ever had one removed? They're very, very common, not uncommon at all. Write in the comments. I'm Dr. Jen Caudle, practicing family physician. Please subscribe to my channel. Click the little bell for updates. I'm on TikTok, Instagram, LinkedIn, WhatsApp, Facebook, all over. And also go to my website, drjencaudle.com, to sign up for my free health newsletter.